Hi, Dr. Kate with New Journey Physical Therapy here. I wanted to go over some videos for exercises for second and third trimester. I had two individuals ask me specifically for this, so congratulations to both of you, and I hope that you find this little video series helpful. I'm going to start out just going over some tips today. So it's key things for you to realize that there's really no exercise that's totally removed if it feels good for your body. So there's nothing you can't do unless it's really physically dangerous. I don't recommend rock climbing. If you're not good on a bike, you haven't biked in years, I don't recommend starting biking, especially on busy streets. Anything where there's a fall or blunt trauma, higher risk of a fall or blunt trauma to your abdomen, that's what we want to remove. In second and third trimester, your baby has grown and your uterus has come out from the protection of the pelvis. So we're concerned about just making sure that we're protecting your baby. That being said, you can do any exercise that feels good to your body at an intensity that feels good to your body. What that means is if you have been exercising pre-pregnancy and through your first trimester, you can continue exercising as long as that intensity feels good to your body. You should be able to continue what you have been doing safely. If you're having pain, I don't recommend continuing. I recommend seeking out treatment. But if you are not having pain, continue what you're doing is fine. If you are starting a new program or you're questioning the intensity of your exercise, we recommend sticking to a level where you can maintain a conversation through your exercise. This is not the time to consider and really make high goals, big goals for making huge advancement in your strength, in your cardiovascular fitness. This is a time for understanding that your body is going through a massive change right now, accepting that fact and allowing it to do its thing. So as long as you can maintain a conversation, that's safe for you and your baby to continue doing. If you're really getting out of breath, you might be reducing oxygen flow through your whole body. You're struggling to get the oxygen you need, and we might be struggling to get oxygen to our baby. So that we want to avoid that high level intensity and looking at making big goals, big gains in your fitness. That's why staying where you're able to maintain a conversation and where you feel comfortable in the exercise and after is really a good level, a good predictor to make sure that you're staying at that level. The last thing that I want you to consider is the one set of exercises that can be really tricky in pregnancy is things on your back. So we don't know. The honest answer is we don't know how safe this is. There are recommendations that after 24 weeks that you stop exercising on your back for more than 5 minutes at a time. There are also recommendations that no one exercise on their back beyond 12 weeks, but that's not really based on evidence. We have one study showing there may be a little bit of a reduction in blood flow beyond 24 weeks, even without symptoms, but we don't really know. So what we tend to say as the most evidence-based recommendation is that if you feel okay lying on your back, you can do a few exercises on your back. But if you don't feel good lying on your back, if you're getting shortness of breath, that's definitely a sign that you're getting some reduced blood flow to your uterus, and you should be rolling onto your left side, waiting a minute to just relax and have good blood flow and getting into a different position, a different exercise. So the one time we really know is if you're getting lightheaded or dizziness laying on your back, then you should not be exercising there. If you're having no symptoms, you're probably safe for up to 5 minutes, and you're likely actually safe longer than that. But that's up to you to decide. The exercises that I'm going to go over in videos over this series are going to avoid being on your back, just because that's not for everyone. So I hope you enjoy them, and I hope you gain something from it and feel a little more confident choosing your exercises in this important time. Have a great day.